A female aged care resident in her 80s has with COVID as WA reported a new record 7,151 cases on Thursday. Premier Mark McGowan, emerging for the first time from 7 days of self-imposed isolation after returning from NSW, announced there were 140 West Australians with COVID in hospital, which is very stable, and by national and international standards a very low number, Mr. McGowan said. 4 of the hospital patients were receiving treatment in intensive care. Mr. McGowan said he understood the latest COVID, the 6th of the state's Omicron wave, was an aged care resident already receiving palliative care. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. It is the second consecutive day an aged care resident has in WA with COVID, following on from another woman in her 80s reported on Wednesday. The Premier said he expected WA was now a few days ways from reaching the peak of daily infections, which modelling has forecast will be around 10,000 cases. The peak in hospitalizations, which was forecast at around 440, is expected to occur around a week later. Mr. McGowan said WA's world-leading booster rate, which is now higher than 71%, meant the state was in a very good position to deal with whatever is coming at us in the coming weeks. What this shows, certainly the low hospitalization rate and a low rate of, is that our preparedness and our high second and third dose vaccination rates have paid huge dividends, he said. There were 15,603 PCR tests conducted on Wednesday, 3,354 of which returned a positive result, a positivity rate of around 21%. The remaining 3,797 infections came as a result of self-reported rapid antigen tests. There are now 31,211 total active cases across WA. Of those, 26,975 are in the metropolitan area. The next highest are in the southwest, Pilbara, Goldfields, Wheatbelt, Midwest, Kimberley, and Great Southern.